Hello, and welcome to the University of Chicago Endocrinology, Diabetes, and Metabolism Fellowship Program. I'm Dr. Meltem Zeytinoglu, and I'm the Adult Fellowship Program Director. And even though we're not meeting face-to-face this year, I'm thrilled to meet with you and to talk to you about our fellowship program. Our goal is to prepare fellows for academic leadership careers in endocrinology through outstanding multidisciplinary training in clinical care and teaching, clinical and basic science investigation, and in research that can be translated into the community. We take an individualized approach with a 2 to 3 year fellowship program depending on your goals and individual needs. Our goal is to enable all fellows to achieve the maximum potential they have given their interests, their life circumstances, and their aspirations. We do this through our tripartite mission of rigorous and rich clinical training, extensive education and didactics, and a rich opportunity of research through our faculty and collaborators. The University of Chicago Medical Center allows us to have opportunities to work with a very unique and diverse patient population. By virtue of our location in the beautiful south side of Chicago, you can see here in this picture, our medical center is unique in that it's located on the university campus. And you can see the beautiful view of the skyline and the lake as well. Our location allows us to provide both chronic disease and acute care in both endocrine emergencies and through our level 1 trauma center for the Southside patients. We also serve as a regional, national, and international tertiary referral system. There are a number of key strengths of our program that I'd like to highlight. This includes our full-time academic faculty, many of whom are nationally and internationally renowned in their areas of expertise. We are kind of unique, as Dr. Cohen will mention, in that we're a combined section of adult and pediatric endocrinology, diabetes, and metabolism. This collaboration and combined aspect allows us to work together very closely, both on a day-to-day basis in our clinic workroom. We often collaborate and talk about shared patients. As children grow into young adults and their endocrine issues evolve, this allows for a very easy transfer of patients in a way that really maintains very good continuity of care. And then from an education and research perspective, we have a lot of collaborative didactics and research opportunities between the adult and pediatric groups within our combined section. Our fellowship includes 2 fellows, typically 2 adult fellows per year, and this allows us to give you a lot of individualized attention. In addition to our 2 fellows per year, we also are unique among only a few programs that have a combined medicine and pediatrics fellowship, and typically we have 1 to 2 med peds fellows as well who really strengthen and enrich our program also. We're proud of our fellow scholarship. We'll come to that in a little bit, and the placement of many of our faculty, our fellows who desire faculty positions upon graduation. We have a very rich body of didactic opportunities, and this includes multidisciplinary fellows lectures, the Endorama or Endocrine Clinical Case Conference, which is led by you, the fellows. We have extensive board reviews. We provide our fellows with both the ESAP, similar to the MICSAP board review, as well as the Endocrine Society board reviews, and we go through those with faculty throughout the year. We have a monthly gland club dedicated to different areas such as the bone club, for example, in addition to a thyroid tumor board that meets every month. We have hands-on tech reviews so that as technologies with both continuous glucose monitors and pump technologies evolve, we can be at the forefront of those. And for those who are interested, we also have outside of our section a very rich chronic disease group and diabetes outcomes group, and our fellows are encouraged and welcome to participate in those as their interests and time allow. I'm very proud to talk about the rich endocrine history that we stand on the shoulders of a number of very important discoveries by faculty from the University of Chicago. So in 1906, Dr. Robert Bensley identified the islets of Langerhans as the specialized elements of the pancreas. And he developed staining methods which would enable to distinguish between alpha cells and the insulin-producing beta cells. In 1941, Dr. Charles Huggins demonstrated that many cancer cells were dependent on hormones to grow, proliferate, and survive, and that depriving these cells of those signals, such as through androgen deprivation, could improve outcomes and or prevent and delay metastases. This finding actually won Dr. Huggins the Nobel Prize in Medicine. Building on the work of Dr. Huggins, in 1958, Drs. Elwood Jensen and Eugene Desambre noted that hormones drive cancers by binding to a receptor protein within the cells. And this led to the identification that targeted estrogen receptor therapies could be used. The Lasker Foundation has noted that these therapies prolong or save more than 100,000 lives annually. In 1965, Dr. Donald Steiner discovered the first prohormone, proinsulin, and how it was processed to the final end hormone, insulin. This paved the way to understand how other hormones and neuropeptides are made and processed, and further enabled the pharmaceutical industry to improve the insulin preparations available for our patients with diabetes, leading to insulins that were less likely to activate an immune response and paving the way for biosynthetic human insulin production. We also have been considered and fortunate to have many of the fathers of modern thyroidology at the university. Dr. Leslie DeGroot, pictured here, was described by the Endocrine Society as one of the founders of modern thyroidology. And his work focused on understanding thyroid hormone synthesis and its mechanism of action. He has been widely considered a pioneer as well in the study of thyroid hormone resistance, iodine metabolism, prevention and treatment of thyroid cancer, as well as autoimmune thyroid disease. We're very privileged still to have Dr. Samuel Refetoff on our faculty. Dr. Sam Refetoff has done much of the work on thyroid hormone resistance and really been sort of the leader in this area, as well as an international expert and referral for inherited autosomal dominant mutations of thyroid hormone receptor, resulting in reduced responsiveness of target tissues to thyroid hormone. And you can see here that along with a former chief of ours, Dr. Roy Weiss, Dr. Refetoff has written and edited a book on genetic diagnosis of endocrine disorders. We're also here to make new history, again, standing on the shoulders of the leaders that we mentioned. And we're proud that we have a number of different ways able to represent your different interests to potentially do this. So we have the Kovler Diabetes Center led by Dr. Lou Phillipson. This is an internationally recognized area center of excellence, particularly for monogenic diabetes. And we're very proud of the referrals and the research that's being done in this area. We have a very strong sleep research center as well, led by Drs. Van Couter and currently also including Dr. Asra Tassali, And much of the work that you all are familiar with on sleep disruption and endocrine metabolic disorders has been done at the University of Chicago. Dr. David Ehrman has done work on PCOS and sleep apnea, and so we're very, very excited to have for fellows who are very interested in sleep disorders this rich center. We have collaborative opportunities within the Comprehensive Cancer Center, particularly, for example, looking at endocrinopathies with novel immunotherapies. For those interested in outcomes research or public health, we have both the Southside Diabetes Program as well as the Center for Chronic Disease Research and Policy, and a very, very rich group of robust research coming from our internal medicine diabetes outcomes group. We have, led by Dr. Matthew Brady, the Committee on Molecular Metabolism and Nutrition. This is a multidisciplinary group that meets with a number of different disciplines and allows for collaboration. And then we also have a very, very extensive microbiome research collaborative. This was led by a very large grant several years ago, $100 million grant. And we actually currently have a fellow interested in the microbiome and metabolic disorders and working, starting to work within this group. So using all of this, we want to come now to our mission of clinical training, education, and research. And I want to tell you a little bit more about each of these things. Our clinical training is through both the inpatient endocrine and diabetes consultation service and through outpatient clinics. Our inpatient service is a combined service where we have both endocrine and diabetes consults. And although there is some variability from cycle to cycle, on average, the consults tend to be split fairly evenly, with about half diabetes and half endocrine consults. We also have a nurse practitioner diabetes service as well. We have, led by Dr. Silvana Panane, post-bariatric surgery consult service, where we help with metabolic management in the immediate post-op period and following that as an outpatient. And then we have an endocrine hypertension consult service, which is also with our endocrine hypertension fellow under Dr. George Bacris. So typically our fellows spend about 14 weeks on the consult service. It is a very busy service, but there is a lot of support, and we try to limit the amount of time that fellows are on service in the first year so that we can allow you to really get into research, teaching, and whatever the unique area that you want to focus on starting from your first year. In the second year, typically it's about 8 to 10 weeks of service. And for those who elect to do the third year, we typically have our fellows cover 1 month of service in their third year. Our clinic is an American Diabetes Association recognized clinic. We have on-site and now virtual as well diabetes educators and registered dietitians. We have within our clinic, we have 2 podiatrists who help us with diabetes foot care, point of care A1C testing, and really unique is that knowing that this is a chronic disease and so much of health, psychology plays a role into this, both as a response to the disease and also in terms of how management of the disease is affected. We actually have embedded health psychologists within our clinic that are available literally on an as-needed basis, you know, the day that the patient is in the clinic. We also have a rich thyroid clinic with both general thyroid cancer, international referral base for genetic thyroid disorders, and a fellow-led dedicated thyroid nodule clinic with on-site ultrasound and biopsy. We have a number of bone experts as well, and we provide on-site DEXA within our clinic. These DEXAs are actually read by Drs. Tamara Vokes, Laura Dickens, and myself, and therefore we're able to do a lot of teaching on DEXA technique and interpretation. We also provide our injection and infusion therapies within the clinic. led by Dr. Silvana Panane is our obesity clinic, both general medical obesity and then post-bariatric surgery endocrine management as well. And within the clinic, we also have by Dr. Susan Sam, a pituitary clinic as well as on-site visual field testing. Led by Dr. David Ehrman is our reproductive and PCOS clinic as well. So you'll have a broad array of training by a number of wonderful experts. We also have several elective outpatient clinics that fellows can pursue. This includes the fatty liver disease clinic, which is a multidisciplinary clinic with GI, additional reproductive endocrinology experience, peds endo, a lipid clinic, ophthalmology, cytology, and an endocrine assay lab. So typically in the first year, fellows will do 3 dedicated attending clinics. These occur in blocks of 3 months, 3 half days with different attendings, and 1 continuity clinic per week. So a total of 4 clinics, half day clinics per week. In the second year, fellows will do 1 to 2 attending clinics per week and 1 half-day continuity clinic. And for those staying on for the third year, there will be 1 continuity clinic. And as always, fellows are always welcome to do additional clinics as they wish. And all years, fellows alternate doing our FNA clinic, which typically occurs every other week. Now, from an education standpoint, we're very, very proud of the dedicated time we have for our fellows for their didactics. And so I'll walk through what our typical week looks like from September to June and share with you some of the highlights that we have. From Mondays are busy days. Fellows are welcome to attend and strongly encouraged to attend the thyroid tumor board, which occurs at 7 o'clock on Monday morning, typically every month, once a month. Every other month, we do a tech hands-on experience where fellows will get to meet with the reps from different companies and experience hands-on what the different technologies we're offering our patients are. And then the required lectures that occur, typically we have a didactic block occurring every Monday from 3 to 6 p.m. This is our fellows lecture series on a variety of both adult and pediatric topics. And this is really unique because it allows you, even as an adult endocrinologist, to learn about pediatric endocrine disorders and how that might affect your patients. We offer the board review that I've mentioned, or a Gland Club at 4 p.m. on Mondays. And then including our faculty as well, we have a rich endocrine seminar, which brings in faculty from across the country to discuss various basic and clinical areas of interest. On Wednesdays, fellows who are interested can attend the Committee on Molecular Metabolism and Nutrition seminar. And then on Thursdays, we have our Endorama, or Endocrine Grand Rounds Clinical Case Conference, where both adult and pediatric fellows lead, and we have robust discussion of various endocrine cases. And finally, for fellows interested in outcomes research, on Fridays, the Diabetes Outcomes Group in the medicine section also has research meetings that interested fellows may attend. This is just an example of last year's fellows lecture series, and you can just, we'll take a moment here just to kind of see the different types of topics and the rich faculty that we have. Most of these are internal faculty. If there are areas where we feel that you know, we can bring in an expert from outside, we're always happy to do that, and we definitely take into consideration fellows' interests and encourage fellows to tell us what other areas they want to learn about. This is just an example of one of the brochures from our weekly Endorama case conference on Thursdays. Typically 1 pediatric fellow and 1 adult fellow will present a case each, and we like this to be very discussion based, and we encourage our faculty participate, and really it's a great learning experience for all of us. Even as faculty, we continue to learn, and this really is one of the highlights of the week, I think, for me and many other faculty. Once a month, this is we do a combined endorama and endocrine tumor conference where we collaborate with our endocrine surgeons and pathologists. So here's just an example of one of the cases that we had with our endocrine surgery fellow. Every other month, we bring in our health psychologists to do a case as well. And so we do this combined health and wellness conference, and typically it'll include a case that was seen by one of our fellows or attendings, and we discuss the psychosocial challenges and how we can learn from that. Now, moving on to research and the extensive areas that our fellows can work on. We have a variety of opportunities in basic and translational research. We have led by Doctors Raghu Mirmira. We have the Center for Translational Research for the Department of Medicine, Dr. Brady and the Committee on Molecular Metabolism and Nutrition. And each of our wet labs allow for fellows to get basic lab research training as well. And so as long as the curiosity is there, we do provide some training for fellows interested. For those interested in clinical research, there are a number of Department of Medicine and university-led training opportunities, such as the Essentials of Patient-Oriented Research and the summer program on outcomes research training, which is an 8-week intensive in the summer that typically interested fellows can take. And we do allow for protected time whenever possible. And you can do statistics and epidemiology and health services research classes. And we can certainly talk to you more about that for those who are interested, or any of these programs. And then for a small subset of fellows really interested in outcomes research, there's an opportunity to do a combined training program with the general internal medicine outcomes group as well as endocrinology. And this is led by, co-led by the rich faculty in both sides. We have within our section a number of wet labs, Dr. Graham Bell and Dr. Lou Phillipson in monogenetic diabetes, Dr. Tony Bianco in thyroid disorders, as well as Dr. Dumitrescu and Refatoff in genetic thyroid disorders and thyroid hormone resistance, Dr. Matt Brady in adipose biology, as well as Dr. Cohen in adipose biology as well. And then Dr. Raghu Mirmira in diabetes. And then I've mentioned already the CMMN committee led by Drs. Brady and various endocrine faculty. And then a number of our fellows, we have one currently collaborating with GI on their primary research project. We've had other fellows work with cardiology, and so the richness of the University of Chicago allows us to have these opportunities. For clinical studies, we have Dr. Vokes leading bone trials, Dr. Phillipson and doing diabetes. We have fat cell biology and obesity. We have genetics with Drs. Dumitrescu and Refatoff, hypertension with George Bacris, sleep and thyroid research as well. And a number of faculties. And what's great is that in addition to doing your own primary research project, because many of our faculty are so involved, there's a great opportunity to be a sub-investigator on a number of trials and really get some more hands-on experience in how clinical trials are conducted. I've mentioned the opportunity to pursue more formalized training in clinical research. In the EPOR and SPORT program, the university also has a Master of Science in Clinical Research for those particularly doing the combined endocrine and outcomes program. I just want to highlight here, this is just from the last 2 years, the richness of our fellows' work. For those fellows who are motivated and want to have good research, the collaboration with our faculty and our own fellows' motivation really allows for some extraordinary work to be done. And this is just a few of the publications from the last couple of years, highlighting also the breadth of the work that our fellows do. Dr. Laura Dickens, now one of our faculty, published an observational study on identifying patients with gestational diabetes at risk for GCK MODY mutations. We have in the leading thyroid journal, Dr. Thayer Idris, along with his mentor, Dr. Bianco, having published on T3 and in treatment of hypothyroidism. Dr. Edelson, one of our current fellows, again working with the mentorship of Dr. Bianco, discusses individualized therapy in JCEM just this month, published, or last month, I should say. And then diabetes-related fracture risk, a study by Dr. Rajesh Jain, one of our former fellows. Dr. Casimiro, one of our current instructor and faculty members, has done extensive work on endocrine implications of bariatric surgery and published on that, as well as her other lead interest in transgender medicine. She was involved in an observational study of hypertension and thromboembolic risk among transgender patients on gender-affirming therapy. So you can see interested fellows have the opportunity to do work in whatever their area that they're interested in, and the outcomes are often very, very good. We have, as I mentioned, for those of you interested, this opportunity to collaborate with general internal medicine and do a combined outcomes fellowship program. You should definitely reach out if that's something you're interested in, so that we can have you meet with those faculty as well. And then for those really interested in extending training in various specialized areas, we have an advanced diabetes fellowship led by Dr. Phillipson, the hypertension fellowship by Dr. Bacris, as well as those wanting to do independent research, the Pathway to Independence and Coggeshall Fellowship. And finally, after what we hope will be, and we know from past, a very rich experience in fellowship training, our fellows tend to be very, very happy with the jobs that they get. With most fellows sort of landing wherever they want, whether that be in many cases we hope academic and teaching, but if it's the right thing for you, then certainly public health, or as well as private practice. You can see that we have, within the last several years, faculty. Many have stayed here at the University of Chicago. We have faculty now, former fellows at Harvard and Brigham and Women, Pittsburgh, Rush University, Temple, and Emory University as well. So with that, I want to welcome you to the University of Chicago program. Very excited to meet with you and to tell you more in person, virtually in person, as well as to learn more about you as well. And we look forward to meeting and working together.